Good afternoon, everyone. Welcome to today's 30-minute webinar, Healthy Vending, 2 Recent Studies to Help Healthy Vending Efforts. This is part of the What You Need to Know to Promote Healthy Eating in Your State webinar series, co-hosted by ASTO, the Food Marketing Work Group, and the National Policy and Legal Analysis Network to Prevent Childhood Obesity. My name is Katie Potasio. I'm an analyst for health promotion and disease prevention at the Association of State and Territorial Health Officials, or ASTO, and I will be moderating today's webinar. Improving the nutritional quality of foods and beverages in work sites and public places, it's a low-cost public health strategy that can help to change social norms and create healthier food and beverage environments. Healthier food through public venues would support healthy eating by many people, including government employees, visitors to public buildings and property, program participants, and institutionalized people such as those in prisons, childcare, or public hospitals. Today we have 2 esteemed speakers on the webinar who will be discussing their recent studies on healthy vending efforts. Following my introductions, Katie Bishop from the Center for Science and the Public Interest will provide an overview of CSPI's new study looking at the nutritional quality of foods and beverages on state and local public property across the country. We also have Colleen Lammel-Harmon from Chicago Park District, who will discuss the Chicago Park District 100% healthy vending policy, showing that healthy options can be both profitable and well accepted by consumers. The evaluation of their policy was published in CDC's Preventing Chronic Disease Journal in August of this year. If you have a question for one of our speakers, please post it to the question box on your screen at any time during the webinar. We will address these questions during the Q&A after both the speakers' presentations. A recording of today's event will be posted to CSPI's Healthier Food in Public Places website in the next few days. We will also share a recording with all of the attendees. Our first speaker today is Katie Bishop. Ms. Bishop is a Nutrition Policy Associate at the Center for Science and the Public Interest, one of the country's leading health advocacy organizations that specializes in food, nutrition, and obesity prevention. Ms. Bishop received her BA in Political Science from the University of Rhode Island and her MS in Nutrition and MPH in Public Health from Tufts University. Prior to working at CSPI, she spent 4 years in the Massachusetts legislature. In addition, she has worked with the Massachusetts Public Health Association and the Nutrition Policy Department at the World Health Organization. At CSPI, Ms. Bishop previously focused on school food issues, but currently works on the healthier food choices for public places. So now I will turn it over to Katie.
Great. Thank you, Katie. So as Katie just mentioned, improving the foods and beverages available on public property is a lower cost public health strategy that is being pursued all across the country. Governments are implementing obesity and chronic disease prevention programs and providing health education. So it's a major contradiction if they're also selling sugar-sweetened beverages, candy, chips, and other unhealthy foods and beverages on their property or serving them through their programs. By increasing healthier options, governments are able to help model healthy behaviors, shape social norms, increase access to healthier options, and provide a more supportive environment for employees, visitors to government property, and participants in government-sponsored programs. And in addition, more and more consumers want healthier options. In a recent survey by the Snack Food Association, it showed that 74% of consumers are trying to eat healthier, 65% are eating specific foods to lose weight, and sales growth of healthier snacks are outpacing traditional snacks by sales growth by 4 to 1. And we're going to hear even more examples of consumers wanting healthier options when Colleen speaks after me. And this is really a growing movement. Many states and localities have been starting to implement policies to improve the foods and beverages on some or all of their public property or through their programs. The policies vary. Some are official policies accomplished either through executive order or through regulation or legislation. And then others happen through more unofficial means, so through contract work or through a department within one government agency. And some cover all government agencies and all government property, and then others just cover one government agency. We've seen a lot of success in this area recently, just in the past few months. California passed a bill which eliminated a sunset on their healthy vending law, ensuring that they would have healthy vending indefinitely. Washington, D.C. recently passed a policy for healthy vending in cafeterias and concession stands. Philadelphia issued an executive order for all contracted foods, meaning that basically all foods purchased by Philadelphia city government will have to have nutrition standards. And in addition, Hollywood, Florida, and Alexandria, Virginia both passed healthy vending policies. And since so much work is going on in this area, CSPI really wanted to do a study to assess baseline what's happening on public property. So we got volunteers from all across the country to look at foods and beverages in vending machines on public property, both state and local public property. We ended up getting volunteers from 37 states, 260 different properties, and about 850 different machines. And we looked at all different types of public property, so things like agency buildings, city halls, town halls, state house buildings, courthouses, community centers, a whole bunch of different types of public property. And what we ended up seeing were that with beverages, about 42% of the options were healthier, meaning that we're almost at 50% there. A lot of states and localities are trying to implement policies to have 50% healthy options in vending machines, so it's really encouraging to see that we're almost there. Looking at the different types of vending machines that are on public property, it would mean that only between 1 and 4 of the beverage lots would need to be changed to get up to that 50% benchmark. At CSPI, we do recommend a 100% healthy policy, but meeting that 50% healthy benchmark is a good first step, and then you can move on from there. In terms of the food options, the outcome wasn't as good, what we found. So about 80% of the options in vending machines on state and local property were either candy, chips, or sweet baked goods. So overwhelmingly, there were unhealthy products in vending machines on state and local property. Only about 5% of the options were healthy items, fruits, vegetables, or nuts. And then 15% of the options were healthier, so things like low-fat chips, whole wheat crackers, granola bars, those types of things. So this really shows us that there is a lot of work to be done, especially on the food side. So it's very encouraging that many states and localities do want to put policies in place for foods on government property because we definitely need them in place on the food side. Another thing that's very encouraging is that there are many more healthy vending products on the market now. So there are lots of healthy products that you could put in a vending machine when states and localities do decide to put these policies in place. So finally, I just wanted to mention that on the CSPI website, we do have a lot of great resources. We have a bunch of fact sheets, things like a fact sheet on making the business case for vendors, tips for successful implementation. We have some toolkits. We have a lot of great resources from other organizations as well as that map of the U.S. that I showed you earlier. And then finally, I just wanted to mention that we are having networking calls in this area. So if you are working to improve the foods and beverages on state or local public property, and you're looking for peers to ask questions to share success stories, to ask about how to overcome challenges, then definitely feel free to email me. I'd love to add you to our email list so that you can be part of those peer networking calls. And now Katie will introduce Colleen for you all.
Thanks, Katie. As a reminder to all participants, if you have questions for the speakers, you can enter them into the question box on your screen at any time during the webinar, and we'll get to all the questions at the end of the presentations. Our next presenter is Colleen Lamo-Harmon. Ms. Lamo-Harmon is the Wellness Manager and Registered Dietitian within the Department of Community Recreation, Health, and Physical Activities for the Chicago Park District. and the Executive Director for the Mayor's Fitness Council. Her position at CPD creates and implements over 3,000 wellness activities, including physical activity, nutrition, relaxation, and leisure programs to youth, as well as adult, family, and senior programs. Ms. Lamel Harmon oversees all 6 wellness centers and acts as the CPD member of Mayor Daley's Interdepartmental Task Force on Childhood Obesity. She first joined the Park District to assist the citywide movement of Chicago Works Out. Chicago Works Out promotes health, wellness, and physical activity to Chicagoans of all ages. The Chicago Park District is focusing on expanding and improving fitness initiatives. So now I'll hand it over to Colleen.
Thank you. And just to update, so it's obviously Rahm Emanuel's, Mayor Rahm Emanuel's council now. And so I will go through some of the interagency success we've had, and hopefully you can get some good tips and examples that you'll be able to use in your city. So we're really happy that we were just in North Carolina a month ago, and we won the top level of amount of people in our city for the Gold Medal Award. And we have really had some pillars in wellness of one of the reasons we did win the gold medal. There are 4 classes of cities that won the gold medal, and Chicago being one of the most populated cities. So I do want to just thank just everyone in general for the amount of awareness we've had around wellness and vending, because this is one of the reasons we won, so I wanted to bring that up. So here's one of our vending machines. We do have some different varieties of vending machines, but to give the history of where we started and where we're at now, back in 2010, the Chicago Park District was awarded a sole source snack vending contract to Compass Group USA, which a lot of people know the parent group is with Canteen Vending. And we required 100% of our items to meet the FitPick guidelines and then also other guidelines that I will go over. So when we first launched the full-out machine delivery, we had 98 machines deployed through our Chicago Park District field houses in 2011, and we are currently up to date at 112 machines. So obviously you can't just go in and say I'm going to change the vending machines. I actually have been trying to do this since I started the Park District in 2001. And in 2003 and 2004, I tried to work with our past vending company to just offer some healthy choices out of the 60 items. And I was not able to do this. They just clear out said no, because it wasn't anywhere in the contract. So moving along, I worked with my partners both at Healthy Kids, Healthy Communities and Plan, and also with Logan Square Neighborhood Association and CLOC, which is the Consortium for Lowering Obesity in Chicago Children, which is the obesity arm of Lurie Children's Hospital. And we wanted to do a case study and get some real background and data to evaluate the accessibility, the sales impact, and the implementation barriers for the Chicago Park District 100% Healthier Snack Vending Initiative to strengthen and support future household vending efforts. So we went through the right partner engagement, and we did find some partners that were involved and some that thought they were involved and they just weren't the right people at the table. We also have participatory evaluation and early attention to compliance, which is, if you're starting, is very, very important, because a lot of contracts can say they're going to do it, but unless there is some kind of a compliance rule, you'll find out longer down the line that they really can do anything they want. So we also wanted to see what our consumer acceptance was going to be, and increasing revenues, which can help counter the fees or revenue loss that can cause barriers to adoption. And one of the biggest, the biggest not complaint, but barrier I found in the Park District was a lot of the revenue and budget administration were nervous that the sales were going to go down. But most sales do either go down or stay stagnant, but then they do rise, and ours did do that. But you really have to do your data before you even go to talk to your budget and your finance department, because I know for a lot of organizations and corporations, vending can be a large string of income in their revenue. So when you're trying to choose the guidelines, there are a lot to look at now versus back in 2010. It was somewhat new. 4 years ago for 100% vending change, and in some cities still very new. So when you look at the actual Vending Machine Association, FITPIC is something that's already set up. And I actually went to a National Association of Vending Machine conference and just came across a table that had this little orange up in the corner. And the Vending Association just nationwide has already started looking at this back in 2010. And so what I did was look at the FITPIC guidelines, which are listed here on the slide. But then I also, just as a dietitian, was able to feel confident to add and change some things that FITPIC didn't feel to engage everything that I wanted to see in the vending machines. So I aligned and studied the American Heart Association nutritional recommendations, and through that we now have a strong relationship with them. And I also looked at the Alliance for a Healthier Generation, which continues to build and update thousands and thousands of pieces of information on their website, from catering to vending to having a banquet for a breakfast to lunch or dinner. So that's another great resource when you're choosing guidelines, because what we want to see is the whole healthy food environment in the Chicago Park District, and vending machines happen to be one of those. So as you can see, it's 35% calories from fat. And so I went ahead and added that seeds, nuts, and dried fruits were exempt from these guidelines because, as you know, most of you know, that the healthy fats are something that we don't want to take out, but we wanted to educate people on choosing the right fat. And then less than 35% sugar by weight. So anything that, you know, like a raisin is obviously coming from a dried fruit. So we did allow that particular guideline to be looked at differently. So if it's coming from a dried fruit or 100% fruit juice, that would be allowed. Our sodium is a little bit higher, and we are looking into that. Some go as down as 200, and because of adding some of our more stringent guidelines, we had to up the sodium level to about 150 to 200 milligrams to be able to have everything in the machine that was needed. And that obviously is a compromise that each city has to determine individually. And then I wanted to offer at least one peanut and gluten-free choice, and we also offer, which is new, not on here, one opportunity that has at least 5 grams of fiber in it. So on here, this actually is a combination, again, of FITPIC and then the Alliance of a Healthier Generation website, and it does just talk about and break down the calories and saturated fat. So this is something that I actually gave to staff because one barrier that I saw before even going out to the field and launching this whole awareness project is the staff was what I thought was going to be my biggest challenge, because a lot of times the staff are using the vending machines, or the staff were actually advising, you know, children and people on what to buy. You know, a lot of the staff in the park are actually talking to the patrons, and they know each other for years, and they'll say, oh, you know, try this, it was good, I had it yesterday. So what I did is I actually sent this out first to let people know what the guidelines mean, how they impact people, and how the staff, from an attendant who is more of like the building engineer or the janitor, up to this park supervisor who's managing, and everyone in between, to be aware of the project and why we're doing it. So again, this is kind of where you're seeing the orange box. That's what you're going to be very, very familiar with, because I think most websites and most guidelines that you're looking at will have these. And with the 35% total fats and calories, that's what you really have to look at if you want the healthy fats, which I do suggest. So this is what our contract looks like. Everything in the machine, well, what's supposed to be in the machine, should follow these guidelines. So no more than 250 calories per serving, no more than 42 grams of added sweetener, and then so on down the list. So we are looking actually at changing this as needed. We actually had our Department of Public Health Commissioner send me a personal email, and he said, what about the antioxidants in the dark chocolate, and if there's something sweet, could we look at having dark chocolate? And we do work with the city very closely on our vending, although we don't have the same contract. This was something that we thought, you know, as a dietitian, I think dark chocolate does have its benefits and antioxidants, and people don't eat as much of it. So we actually did add 100% dark chocolate with almond bars into our machines as well. So making healthy options easier through pricing, marketing, and education. And I would say all three of these are just as important as the other, because if they're super healthy products and they might not taste good or they're super expensive, people are not going to buy them. So we wanted to price it right, we wanted to market it in the correct way, and we wanted to educate people on that. So we offering at least one healthy option in vending machines at the lowest price and most compelling marketing. This encourages people to purchase these products, and the same strategies can be used to promote healthy options by lowering the price, increasing the visibility, and highlighting the healthier options, or healthiest options. So with our vending, we pretty much, this first bullet point doesn't take as much weight because we offer all of our products to be healthy. So there was no kind of a benefit to choose one over the other, and we priced all of ours the same. However, I included this because in our beverage contract, which came after the paper came out with the Center of Disease Control, we have now engaged and started rolling out our healthy beverage contract. And so what we have is 0 sugar sweetened beverages, which include some diet soda type drinks or diet iced teas, but then we also have sparkling water. So we actually give a lower price point for the straight out water. And that is something that we have found success in. Using education and marketing to promote healthy products. So we had taste tests, and most vendors will work with you on this, if not the higher parent company like a Quaker or a Kellogg, to say, we're putting this in our vending machines, can we have some samples? So we did actually taste testing with both parents and kids. We also educated the staff. We looked at different areas, but we actually educated the staff on why we're changing the vending and how it can impact their life. As I spoke of earlier, educating the staff on the user voice. So advisory counselors are someone who come in the park and they advise, they're really the champions of the community of what is needed in the parks. And so we actually did one of the taste testing in one of our large education sessions with advisory councils, wellness teams, and definitely within the human resources for Chicago Park District. Working with the vendor is something that never will end. You always have to work with the vendor, and as I said earlier, you have to get it in writing to price healthy foods and beverages at the lowest cost, because a lot of the drivers are on commission. And so although the CEO of the vendor corporation may say you have to do this, we're finding that the drivers were putting some non-compliant snacks. And it didn't happen extremely often, but it did happen enough that we did have to fine them. And then they did re-educate their drivers, and then unfortunately some people did get let go because of it. So we found that with our vendors, they are serious. They are really trying to get this contract to follow exactly what we put in writing, and then they know if it doesn't, then there is going to be some effect of that, and they will be fined. Placing healthy items at eye level with options to change placement. So this is something that, again, they're all healthy in there, but there are some healthier options than not. So, the 100% fruit juice snacks, like the Welch's, they did fit in there. The snack world that cookies did fit in there. But more the trail mixes and more the almonds, those are things that we thought had more of a nutrition value. So we did put, we do look at placing those more in the middle of the machine. And then placing the adult snacks more at the top of the machine. We have had Luna bars in there, and then we had more child-friendly products. So we do place those higher and lower in there. Using signage, so we have some snack machines that are unfortunately in not a very high traffic place due to the building layout and also electric needs, which people don't think about until we start to place something in a building, and it might be sharing an outlet with something and a switch can blow. So those are things you don't necessarily think of, but because of those challenges, we had to sometimes place a machine in not the most ideal place. So what we did to solve that problem was we put signages, hungry, question mark, go here, or snack vending, just snack vending with a arrow pointing where it is. And then also educating all the staff, whether new or have been there, where the snack machines are. We do try to limit the advertising on vending machines to healthy food and beverages. So right now we don't have any corporate advertising on there. It just says balanced choice and then the guidelines of the 250 calories and so on. And so ensure vending machines post calories next to each item in accordance with FDA requirements. So I would recommend trying to do this. However, the vending machines are very small. So what we had to do was just keep a booklet in the park with the nutrition value and the ingredients. So it is very hard to post every single calorie amount, fat amount, because those vending machines are so small. That is a challenge. But if you can put it in the writing, you will at least have it in the park somewhere. So example contract language, and this is something that's actually on the Chicago Park District website, but I would love to take the credit, and we will not do that, because I will say that although we did make some creative contract language, N-Plan was our roots of what we could write. We had conference calls with N-Plan a few times, so we did make sure that the contract language was something that was a sample, and there's a lot of states and cities and villages and townships out there that I would say to really look at. You could do 100% compliant, you can do 50% compliant, but I will say with that it's going to be a lot more work on your part to see what's compliant and what's not. And then just going through choosing the guidelines, setting fines we talked about. Tracking sales is very, very, very important, not only for you, but to be able to fight that fight when needed with finance and budget. And then working with the companies, providing samples, you doing the legwork sometimes of what snacks would fit. Having a little bit of a delay with switch over. There we go. So just jumping back of quickly, how do you start and where do you come from? You have to connect yourself with the research department unless you are linked with the university already. You have to find that right person to be able to do the intervention. So we did lead 2-hour-long nutrition educations led by Chicago Partnership for Health Promotion, which is out of University of Illinois at Chicago. We did hypotheses and intervention, so we asked the staff their nutrition knowledge. We asked the staff support of healthy snack vending, and then also sales of healthy vending items compared to control parks that did not have the education. And the outcome. So we had 100% support from the staff that they wanted the healthier items, that they increased their nutrition knowledge, and then the patrons had about 88% reacted positively to the initiative. And obviously this was just the first couple years is within 1 to 15 months, we went from $84 to $371, which is a huge range, and you'll see in the next slide how much more we've gone up. And then again, you have to have those vendor compliance conversations of what's going to happen if they stock with non-compliant. So when you're choosing parks, we have 580 parks, 256 of those are staffed, so it's obviously a huge amount of land we're looking at. We were very careful of who we chose, and so we wanted to have 2 compared groups, and so we went with 2 Latino communities, and then we went with 2 African American communities. And then with that, what we did was we looked at a control and obviously an intervention park. So what we look at and what we continue to look at from the beginning to now is we get a report every single month of what's selling, what's not, what exact items are in there, and that's usually when we catch them putting non-compliant snacks in, whether it be a mistake or purpose. That's another, someone has to dedicate time to really go through that report. And then we have something to discuss and we have data to talk about with the vendor. Our price point did start at $1. But our revenue department and vendor did decide that they wanted to go up to $1.25. It hasn't made a huge difference. It's just, being a parent is kind of a pain to find a quarter on you when you have $1. They did add some credit card machines in as well, which did make it easier for that. Finding a relationship. So you really have to find who are your internal and external teams. And I would say always choose some external team members, because when you don't feel comfortable fighting the fight, obviously a friendly fight, you have external team members like our CLAC and like our universities to really help with that. The relationship with Compass, as I said, goes, we have meetings every other month, so that's an ongoing thing. So coming to an end, where we started and where we're at, the second quarter of 2014, we sold 61,987 items. We brought in $75,639, but then by the time you pay for it, we brought in a commission. We have a 15% commission for our snacks. We have larger for our beverage, but that's a whole other story. We brought in $11,350 just the second quarter, and then the fourth quarter, $74,522, $90,588, and then brought a commission of 14. So those are broken down into quarters. So we're averaging about $45,000 a year commission. Multidisciplinary efforts on healthy eating in Chicago Park District. So as I said, we have an interdepartmental agency for obesity out of Mayor Rahm Emanuel's office. And we also are finding similar community partners to assist with monitoring, education, and grassroots efforts. So if one of our partners who's been involved does see something, a machine that shouldn't, or a machine empty, that's another problem we've had, or a broken machine, that they're helping monitor as well. Sharing work like we are today with other agencies is strengthening the awareness and acceptance. We're looking at our after-school snacks, although we're following, the FDA guidelines and the summer food program guidelines. We're also looking at doing nutrition education, and also looking at things like trying to change, juice oranges to clementine-style tangerines so the kids can eat the fruits easier instead of just saying it's too hard to eat and throwing it out. And that's with the day camp and the after-school lunches. Decreasing candy and overall food purchases. So right now, any time a park orders food, it has to go through the wellness department, which is, huge to take on, but it does. It's been about 2 years now, and it is getting easier because people do get educated on what they can buy and what they can, and they don't want to put a high-fat, high-salt, high-calorie food in because it's going to get denied, and it's just a waste of time for everyone. Guidelines and banquet and event orders. That's again what I talked about with Alliance for a Healthier Generation. And then our biggest effort, obviously, is what we're talking about today with the Healthier Vending, which launched in 2010, 2011. And then here's a paper working with community partners to implement and evaluate the Chicago Park District 100% Healthier Snack Vending Initiative. And as you can see, these are all the individuals who were part of the paper. We all took it as a team, and we've gotten a few poster sessions. We've made it into Time Life online. We've really had some major success with getting it out in the media, and I made sure to include the actual link here. Next steps is our beverage vending. It is done, but there are some steps that we still need to clean up. They're all 100% non-sugar sweetened beverage machines. It is with the Coca-Cola partnership, but we did do a partnership versus a contract because they're also giving money to Healthier Wellness Lifestyle Initiatives. So they're actually going to fund our teen fitness programs and also some of our wellness components in day camp. And everything I talked about on the other side is also what we've already discussed. So here's my information. We are willing to share a contract with you. I thank everyone on the call because we can't do it alone, and it's going to take all of us to really take this to a national level and make healthy vending the norm. So that's all I have for you. Thank you.
Great. Thank you so much, Colleen. And thanks to both Colleen and Katie for presenting, and also thank you and your organizations for contributing these important studies to the growing literature base for healthy vending and healthier food in public places. This is great. I will also add here that here at ASTO, we've been working over the past few years with 12 states on increasing healthy food in public places with a specific focus on sodium reduction. And more of the states are now tackling healthy vending as part of that work. So as Katie said, this is definitely a growing area. And any state health departments that are in attendance on this webinar, if you are interested in joining our learning community, you are welcome to. You can read more about our healthy vending and sodium reduction work on our website at asto.org. And you can contact us to let us know if you want to participate at chronicdisease@asto.org. So at this time, we are over the time limit for the webinar. I think we will just ask one question. We have one question for Colleen, and then the others we might respond to and then post that along with the recording and copy of the slides on CSPI's website. But Colleen, one question that came in was, what are your top 3 best-selling products, both for drinks and food?
The drinks I don't have, but I can get back to you on that. We do find that the sparkling waters I know, and actually the Coke Zero has been selling well along with the Powerade. But that's just from the reports I've seen. I don't have it right in front of me. Now, the top-selling snacks is really interesting because we break it down by top-selling snacks by park, region, and then overall. But I will say that unfortunately, the Baked Flaming Hots was one of those that was coming up on a regular basis. Also the nut mixes, which I think is great to see up there. And then also the granola bars that we offer were the 3 top selling, and then behind that we saw the fruit snacks as one of them. So it is, again, these aren't curing diseases, but they're better than what we had in there before. But those are the top 4 that we're hitting in the last quarter. So overall, that does change. We look at it every single quarter, and funny enough, it's not consistent every month. So it depends on what the communities are choosing.
Great, thank you. So thank all of you for your participation in today's webinar. Thank you for the questions that were submitted. Again, we will, the speakers can respond to these, and we'll post it as a document when we're sharing the recording. Thanks again to our speakers, Katie Bishop and Colleen Lemo-Harmon. We hope that all of you will use these new studies as a resource in your own healthy vending efforts, and also share it with others. So in a few days, we will share the recording, and it'll also be available on CSPI's Healthier Food in Public Places website. This concludes today's webinar. Thank you, and have a nice day.
Thank you. Catherine?